Workplace Violence in Nursing, Issues of Violence Among Nurses by Emily Fisher. Workplace violence among healthcare workers. Violence among healthcare workers has been a growing problem. Throughout this presentation, I hope to share some information that may be helpful in understanding why workplace violence occurs and how we as nurses can protect ourselves. Healthcare workers across the country have begun to stand up for their rights, and changes have been happening. Knowing how to protect yourself and being aware of this issue is the first step to reduce workplace violence. Workplace violence. Workplace violence in healthcare is a public health issue and a growing concern. Below is a chart that illustrates the growing concern from year to year. From 2011 to 2018, the incidence rate of non-fatal workplace violence to healthcare workers has increased significantly. Below is a picture of just some of the injuries nurses and other healthcare workers have endured while simply trying to do their duty as a healthcare worker. Nurses say violent assaults against healthcare workers are a silent epidemic. There are different types of workplace violence. The National Institute for Occupational Safety and Health defines workplace violence as violent acts, including physical assaults and threats of assault, directed toward persons at work or on duty. Physical violence and psychological violence. Physical violence is defined as any physical force intended to hurt, damage, or kill someone or something, such as kicking, hitting, spitting, and sexual abuse. Psychological violence is defined as an act that causes psychological harm. This includes verbal abuse, sexual harassment, racial discrimination, intimidation, and threats. The National Institute for Occupational Safety and Health classifies workplace violence into 4 basic types. Types 2 and 3 are the most common in the healthcare industry. Type 1 involves criminal intent. In this type of workplace violence, individuals with criminal intent have no relationship to the business or its employees. Type 2 involves a customer, client, or a patient. In this type, an individual has a relationship with the business and becomes violent while receiving services. Type 3 violence involves a worker-on-worker relationship and includes employees who attack or threaten another employee. Type 4 violence involves personal relationships. It includes individuals who have interpersonal relationships with the intended target but no relationship to the business. Statistics of nurses and other healthcare workers who have experienced violence. Healthcare workers accounted for 73% of all non-fatal workplace injuries and illnesses due to violence in 2018. A recent study found that 44.4 and 67.8 of the nurses reported experiencing physical violence and verbal abuse, respectively, between February and May/June of 2020. A comprehensive study, which included 253 eligible studies with a total of 544 participants. Of these participants, 61.9% reported exposure to any form of workplace violence. 42.5% reported exposure to non-physical violence, and 24.4% reported experiencing physical violence in the past year. Verbal abuse was the most common form of non-physical violence, followed by threats and sexual harassment. The chart below represents violence among healthcare workers versus other industries. As you can see, from 2011 to 2018, healthcare industry experienced significantly high rates of violence. Which nursing department is at the highest risk for violence? Psychiatric units and emergency departments have the highest percentage of occurrence for violence, Below shows some statistics specific to violence within the emergency room. Other high-risk nursing areas are correctional facilities, psychiatric nurses, who make up 41% of all assaults in healthcare institutions, home health nurses, and long-term nursing facility nurses. Workplace violence is drastically underreported, therefore making it difficult to rate the most dangerous nursing specialties. But nursing specialties that have persistently reported high levels of violence were listed. Risk factors for violent patients. Gender and age. Male gender and age are among the strongest predictors of violent behavior. Men younger than the age of 35 are the highest offenders of violence against healthcare professionals. In a survey of 115 psychiatrists, they found that 68% of assaulted patients were 30 years old or younger. Mental illness is another risk factor. The National Institute of Mental Health examined the rates of various psychiatric disorders in a representative sample of 17,803 subjects in 5 United States communities. They found that patients with serious mental illness, such as schizophrenia, major depression, or bipolar disorder, were 2 to 3 times as likely as people without such illness to be assaultive. Substance abuse, prior history of violence or trauma, and medical conditions like head injuries, hypoxia, dementia, metabolic disorders, and seizures are all more risk factors. Internal risk factors. Significant wait times in emergency departments and clinics, unrestricted access to public, low staffing levels in hospitals at certain times of the day, healthcare workers who are isolated during patient care, solo work with remote access and limited security availability, lack of proper training and experience of staff, handling money, transporting and delivering patients, and guarding valuables. External risk factors. Prevalence of handguns and other weapons among patients' families and friends or coworkers. Increased use of the hospital by law enforcement and criminal justice system for criminal patient holds. Care of acutely disturbed and intoxicated persons in the healthcare setting. Increased number of mentally ill patients released from hospitals without outpatient follow-up. Availability of drugs, money, and other valuable items at hospitals, clinics, and pharmacies, increased prevalence of gang members, drug abusers, distraught family and friends using healthcare setting, limited lighting in many settings, including parking garages, surrounding public areas, and walkways to access physically separate buildings, working in high crime area, are all external risk factors for violence. As this picture shows, nurses are beginning to rally against workplace violence and stand up for their rights. Healthcare professionals are taking a stand, and positive changes have been happening. Assaulting a healthcare professional who is engaged in the performance of his or her official duties is now considered a felony in many states. As you can see on the map, the felony laws cover nurses in all of the purple states. In the yellow states, the current law is still vague, and in the white states, the state has not yet passed the felony law. How can we protect ourselves? Identifying high-risk patients is a key to staying safe as a healthcare worker. At Unity Point, we use a tier system. We have Tier 1 and Tier 2 patients. Tier 1 patients warn staff to be especially careful and put precautions in place for the patients and staff. Tier 2 allows everything that Tier 1 does, but it requires that we have security or police on the unit at all times. Alarm systems, such as pinpoints that all staff can wear, safety training to staff, such as trauma-informed care and crisis prevention to help better prepare staff, recognize patient triggers like expectations not being met or the feeling of loss of control, and report and document violent events.